The state advances the COVID-19 vaccine rollout to phase 2. When can you get your shot? On this episode, hear from one of our experts about the new phase and what you can expect.
Whether you live in or just love Johnson County, Kansas, JoCo on the Go has everything Johnson County. Here's what's happening and what's coming up in the community you call home.
Thanks for joining us for JoCo on the Go. I'm your host, Teresa Fried, a Johnson County resident and employee of Johnson County government. Phase 1 of the state's vaccine rollout plan is wrapping up. That group includes healthcare workers, long-term care staff and residents, and those involved in pandemic response. Now we're about to begin phase 2, a substantial group that's at high risk for complications and exposure to this deadly virus. Here to talk more about that is Johnson County Department of Health and Environment Director, Dr. Sanmi Areola. Thanks again for being here.
Thank you for having me, Teresa.
All right. Well, first off, I think, what's on everyone's mind is how and when can I get the vaccine? But first, we really want to talk about phase 2 and who's in that group. So if you could talk about that first.
Yes, phase 2 is a fairly large group. We've got our 65 or older residents. We have educators in our K through 12 schools, and that include other staff, custodians, drivers, and we've got operators of childcare establishments, again, including all of their staff in there. We have first responders, emergency services, police and fire. We have also in there our food and agriculture sectors. Restaurants and bars, retail, grocery stores. That's a fairly large group. Just looking at estimates that we have, we could be looking at up to 150,000 persons in this category. And so we will need to approach this in multiple ways. And of course, the big variable still is how many vaccines we are getting from the state every week.
So we are using a slightly different system than the state. The state has the phases, and we, of course, have the phases as well, and we're moving with the state. But we also have tiers within phase 2 because that group is so large. Can you talk about how those are divided?
Yes. So the state makes the decisions as to what is in the phases. But we have a prerogative in when we're executing this to prioritize within the phases, and that's what we have done. And it is again, it's a very large group. In phase 1 is largely the group that I've talked about. In tier 1, I'm sorry, phase 2, tier 1. In tier 2, then we get into congregate settings like corrections, like our shelters. And again, to be clear, the putting different groups into phases is not while we look at factors of risk and look at factors of equity. It is primarily because it's just impossible to do everyone at once. So we do need to space that out. And that's why it becomes very important for our residents to be patient. Especially, we got 6,800 doses this week. If that's what we continue to get, and that's the only thing coming into the county, you can do the calculation yourself. So we could be doing this for the next few months. And so, candidly, that's very close to the feedback that we are getting from the state is based on the allocations that are coming to the state, that this may be what we're getting, and this may be what we have to redistribute across the county so that we can vaccinate our people. So we've got them in tiers, and we would and so we are going to open up, for example, some of slots for people to be vaccinated next week, and those are going to be a subset of tier 1 because tier 1 by itself is very large. Again, our appeal to our residents is patience. I think it's absolutely fantastic, absolutely impressive the number of our residents who are ready and willing to take the vaccine. It's not very it's not very good that we don't have enough vaccines to give. And so for us, the primary message is an appeal to our residents to be patient, and we're trying our best to give this out as quickly as we can. We're trying our best to make sure that we are clear and explain to our residents how we are making those decisions and who will qualify. But there's just so much you can do with 6,000 doses in a week coming to a county of more than 600,000 persons.
And something interesting I thought you said the other day was just talking about how quickly we are getting vaccine into the arms of residents. So can you talk about what that process is in terms of receiving the doses and then scheduling clinics and then reaching out to the people who have expressed interest?
Yes, thank you. We are opening vaccine clinics Tuesdays through Fridays. And every week we have given out the vaccines as quickly as we've received them. This week is actually the first week where we've had enough vaccine to open clinics Tuesdays through Fridays. Last week we didn't have vaccines on Monday. We just started receiving and getting word that we will receive some that Tuesday. So we received a few Tuesdays from KU Med and Health Partnership, and we opened clinics the following day. So without those ones, we would not have been able to open clinic on Wednesday and Thursday, because the allocation we got from the state did not come in until Thursday. And so we received that week a few on Tuesday. We opened clinic on Wednesday and Thursday. We received the state allocation on Thursday, which allowed us to do our clinic on Friday. And again, and then this week we've run our clinic Wednesday, Thursday, Friday. We got another shipment yesterday. We still have some people in phase 1 that are yet to be vaccinated. We're still going to be doing those, but later today, we're going to open up the slots for vaccination next week. Again, it's going to be open up not for everyone. People, a subset of tier 1, phase 2 tier 1. And then we just do that based on the number of vaccines that we get. And we've got partners across the county lined up that are ready to vaccinate people if we get vaccine. If we get vaccines, we've got our health systems that are ready communicating with their patients to say, hey, you can get your vaccine here. Again, the primary variable here is how, when and how many vaccines that they get. But we've got our plans. We're a larger county than some of the smaller counties. Smaller counties can have a system where they say residents register here, we'll call you down the list as we get vaccine. We're a larger county and we've got to have a more robust system. So our plan is really use our resources, and that includes the partnership with our hospital systems, which we have done, and already they have systems in place to vaccinate, and really broadly they have a system to scale up and to increase throughput if the vaccine is there. So it needs to be that we are vaccinating, they are vaccinating, our health partnership clinic is vaccinating, and that's how quickly we could make this work if we have the vaccine. But our plan is ready to do this. Our plan is very robust, and once we get vaccine, we'll be able to get it into the arms of as many residents as possible, as quickly as we can.
And with that efficiency that we're working towards getting the vaccine into as many arms as possible, as quickly as we can, some questions are out there about the second dose. Are those being reserved for individuals who've already gotten their first vaccine?
We have been sent the second doses as scheduled, and that's a good thing. So when people get their first dose, they get a card, and our staff verbally remind them that they need to schedule an appointment so that they can be vaccinated. So the vaccine is here if you have taken your first dose. So check your card. When we open up appointments, book a spot, come in, get your second dose so you can have the full benefit, full immunity from the vaccination.
And just to talk a little bit more about the partners that we have lined up for phase 2 distribution, can you talk about who's going to be serving which subgroups?
Thank you for that. We have health systems, the larger ones, KU Med, Advent, Olathe Health Systems, and St. Luke's and others. And they are going to primarily focus along with us on the 65 plus category, our residents that are 65 years old or older. And that's the largest group there. Now, secondly, the second category, Children's Mercy Hospital, is going to be focused on vaccinating our educators, K through 12, as well as our childcare establishment. And we have all of those worked out, all of those written down and mapped out. And we are in touch with them on a regular basis, and in touch also with the schools. The superintendents are aware of that. We have numbers that we're working with, how many they have in each of the districts. And so we are ready for that. And then similarly with childcare establishments, because we also regulate these entities, we already have relationships with them throughout the COVID response. We have we are in constant communication with them. So that's going on. A survey is going out today to those childcare establishments to better farm up our numbers. How many people are there? What percentage of them are willing to take the vaccine? And so those are ongoing. That is what Children's Mercy is going to focus on. Then our food and agriculture category, subset of that will be largely what Health Partnership Clinic focus on. And in our police and fire category, again, it's not a very large group. We have a plan in place also to ensure that they get their vaccine and working with them, because some of the fire guys are able to vaccinate. They're able to give injections. So we're working with them where it's a different system that it's not necessarily clogging up the spots that we have, but where we make another arrangement where our staff are able to vaccinate them in a way that's more efficient outside of the spots that we have to vaccinate people. Now, again, when we do that and when it happens, it's a function of when vaccine becomes available to us.
And I know we've done 2 surveys so far, one for phase 1 and then one for phase 2. Can you talk a little bit about the purpose of those surveys and how that contact information might be used as we move forward to actually book appointments, and what the process of booking appointments will look like?
Yeah, thank you. I think the response to the survey that we currently have for phase 2 has been pretty good. We do know that when we open it up, that has some issues with it, with many people getting on at the same time, but those have been fixed. And it's very important for people to complete that. The primary reasons for that is while it's not signing up for a vaccine spot, it allows us to fine tune our plans to know how many people we're working with, how many people are willing to take the vaccine, and how do we spread this out? All of those logistical details, that's helping us out. How many residents who are willing to take it are over 80 years old? How many are over 75? All of those are things that are important for us in terms of our planning. But it's also very important for you because when we have your information, your email or your phone number, we're able to push information out to you. So if you haven't completed that yet, please do. With the healthcare workers, that was a survey that was also very helpful for the same reasons. It wasn't booking a spot to be vaccinated, but it allowed us to reach out to you with information when we have spots open to say, hey, spots are open, go, here's where you need to go and book a spot. I expect for the next, for the foreseeable future, that the spots that we have open will not be a lot, just based on the number of vaccines that we get. But every day that we have clinics, we are chipping away, we are vaccinating more people, and we are moving towards our goal. We may not be sprinting, but we're clearly walking towards our goal. And so very important for people to complete that. It helps our planning. It also helps you to receive information directly from us, whether by email or by phone.
Okay, and that information will be on our website. We have a vaccine webpage, and we'll have a link to that in the show notes of this episode. As you mentioned, our end goal is to get rid of this virus. And so we need to reach herd immunity. And so can you talk about what that is, and then how close we are and how we know what our progress is towards that?
Yes, so we are now beginning to lean more towards using words like population immunity or community immunity, but the technical word that we've used for a long time is herd immunity. And basically what that is if we have a certain percentage of our population immune, then we basically obstruct or disrupt the chain of transmission of the virus. And so part of how this virus spreads is you infect one person is able to infect 2 or 3 persons. Those 3 people, if they're infecting 2 people each, it just starts to double. So what immunity does when we have enough people vaccinated is that those paths are disrupted, and it doesn't allow the virus to proliferate or to spread in the community as much as they would have, which eventually leads to suppression of transmission in the community. That number for us in the United States as a country, we think the closer to 90% it is, the better. And so we're still ways from there, but and that's why it's important for us as we do all these things that we continue to wear our masks and physically distance and avoid large crowds. We're not there yet, but we will get there. It's right now because we really haven't vaccinated a significant portion of our population. If we look at, we don't have the full pictures yet, but I suspect that by the time we finish all the vaccination through the federal pharmacy partnerships, by the time we get the numbers through from the vaccination that our health systems and hospitals have done, what health partnership have done, and ourselves thus far, that we might already be approaching 9-10% combined, because again, depending on whether you're using 615 or 620 or whatever number for a county, we might be approaching that very soon. Still far from there, but huge progress, better than where we were early in December.
Yeah, some good words of hope there. Just to bring it back once again to the big questions on everyone's mind: when and how do I get the vaccine? So, bottom line is take the survey if you're in phase 2, and that's available through our website. You can get a link there, and we'll again have that in our show notes. And then also pay attention to what your providers are communicating about the vaccine availability as well. Is that right?
That is accurate. Yes, pay attention to the news. If we have your information, we'll make sure you receive those things. Pay attention to communication from your providers. Those are the right things to do.
And be patient, right?
That's absolutely important. We don't have a choice. The vaccines are going to be coming in, not in the amount that we need them. And again, I will say, understandably so, because we've got millions of people across the country who are willing and ready to take the vaccine. And at some point, it will catch up. We'll have additional vaccines approved in the market. Until then, though, patience is a virtue.
All right. Well, thank you again so much for being with us, and thanks for listening.
Thank you very much.
You just heard JoCo on the Go. Join us next time for more Everything Johnson County. Have a topic you want to discuss? We want to hear from you. Follow us on Facebook and Twitter at JoCoGov. For more on this podcast, visit jocogov.org/podcast. Thanks for listening.